I really wish, I'm sorry, Reese, we don't have a computer. So these are the history. So I'm going to read the history. The patient came into the AT room before practice complaining of lower back pain and radiating pain down the leg. She sits long hours of the day in a flex position in front of a computer taking online classes and doing homework. And she says that when she bends over, it increases the pain and then the pain shoots down her leg. The patient says that the pain has gradually increased over the last few months since the beginning of the semester and noticeably limped into the AT room holding her lower back with pain on her face. She has no previous injury to her back, and when she's sitting in neutral with a neutral spine, it actually alleviates the pain. So what I'll do is I'll begin after this with palpation of her lower back. If I can get her shirt up. So I'll begin by palpating down the spine, looking for pain, which will most likely present in the L3, L4, and S1 area. I will check both sides. And then after palpation, I will have her actually come to the edge of the bed and sit, facing me, sitting down, please. Thank you. So what I'll have her do is I'll have her bend forward. So I'll have her bend forward, and that's going to produce pain. So when she sits back up, this will alleviate pain here, and then I'll have her lean backwards, which may cause some pain, but not too much. Good. When she bends forward, she's going to complain of pain shooting down the back of her leg. So next what I'll have her do is I'll have her cross her arms across her chest and rotate to the right and rotate to the left. And the patient may complain of pain in these rotations, especially while bending forward. Next, what I'll have her do is I'll have her lean to the right and lean to the left. Okay, good. And now what I'll try and do, I don't know how I'm going to do this because it won't rotate. So what I would be doing is I'll have her grab her chest again, and now I will have her rotate to the right, other way, sorry.
It's the left one.
And then I'll place my knee here to keep her in place while pulling here to see if that elicits more pain, if she can. And then I'll do the same thing on the other side. Okay, and then same with forward. I'm assuming she won't be able to go much more forward, but I would push down as she's in flexion, and same with extension. I would be behind her, holding her here where my foot is, and pulling her back into that. Same with the sides. I'll have her bend to the right, or left, my right, holding her here and pulling her or pushing her, looking for pain. So next, what I'll have her do is I'll have her lay on her stomach again. I'm going to get into manual muscle testing. So now what I'll have her do is, while supporting her pelvis here, I'm sorry if you can't see, I'll have her lift her whole front of her body up towards the ceiling, looking for pain. And then now I'll have her roll on her side. Good. Holding her here, and her legs, I'll have her come up off the table again. No.
Oh, with my upper butt.
Yeah, with your upper butt. Not using you're not supposed to use your hand. Put your hand on your side. Now, come up.
That's as
Right.
good.
And then rotate to the other side. Same, supporting her at the pelvis and at the ankle to keep it locked down so that she can come up. That's good. And then I'll have her, again, roll over onto her back.
Onto my back?
On your back. Okay. Hands across your chest. And now do a sit-up and go back about 45 degrees.
Oh, God.
While I'm supporting, obviously, her feet, but I only have one hand. And I'm looking for pain as she's coming up, which will most likely be what happens. So with this, I've noticed that she has lower back pain. I'm thinking at this point either a herniated disc or sciatica. So what I will do now is lay her back, and I would test resistive range of motion. So that will include what we just did. So I'm not exactly sure how I'd be able to do this holding one hand. Anyway, I'll just explain. I'll go through the motions, resisting those motions, and then I would have her sit up again and come forward. And now what I would do is I would do the same thing as I did before, stabilizing her knee here, having her turn this way while resisting that motion. Same with this side. Okay, good. And now coming forward. Good. And then backward. Good. So again, I'm thinking at this point, I'm thinking herniated disc or sciatica. So I'll get into special tests, so I'll have her lay on her back and scoot back to the edge of the bed. All the way back. There you go. So now I'll have you hold this so that hopefully she can see what I'm doing. So to rule out herniated disc, I'll do the straight leg raise and up. And obviously this would be better if we had a table on both sides. And what's going to happen here is that there's not going to be any pain, which will rule out a herniated disc and most likely diagnose with sciatica. So I'll take that. So what I would have her do is I would have her come in for rehabilitation. We're going to work on postural correctiveness and some strengthening. I guess first I forgot that I'm going to put this in the video. I'm not going to restart this 7-minute video. So come down here. I'm going to check for dermatomes and myotomes. So what I would do is I'm checking, go ahead and move your hands. So I'm checking, this will be L1, L2, L3, and L4 and S1 for if she can feel either less feeling or numbness or tingling, pins and needles. So I would check that, and I'm looking in this area for decreased, what's the word I'm looking for? Sensibility, I guess you could say. So I'm going to be testing now to make sure, goodness, I'm freezing. So let's see. So L1 would be extension of the hip, and L2 as well, and then knee would be L3. So what I'll have her do is I'll make sure that what I'll have you do is straighten your leg out, and then pull it back in. Good. And then what I would do is resist that motion. Go ahead. Good. Now put your foot out so she can see. So now I'm going to have you pull your toes, your ankle. There you go. Good. Now do it again. Good. Okay. And then I'm going to check big toe also. Good. Okay. And do it without me resisting. Okay. So I'll be checking those. Those would be most likely be diminished. And the last thing that I would check is her reflexes here, and I don't have a hammer for that. So reflexes would also be diminished. So now I'm going to go into what we will have you come in for rehab. What we will do is postural correctiveness. We will reteach you how to sit correctly. It's going to involve rest. It's going to involve some increase of mobility, range of motion, and eventually some strengthening as well. So that's it. She has sciatica. Boom.